Thank you for the opportunity to present our work at the conference. The title of our research is The Impact of Education on Tobacco Use and Alcohol Consumption in the Dominican Republic, a Social Grading Perspective. My name is Michelle Jimenez de Tavares and I'm a PhD student at the University of Illinois. My collaborator is Dr. Flavia Andrade. Socioeconomic status makes the difference across individuals, and this is what we call the social gradient of health, which not only results from these social differences, but also shapes human health and life expectancy. According to the social gradient of health, higher life expectancy associates with lower levels of poverty, and consequently, lower income associates with higher levels of social and health problems. Among all socioeconomic status indicators, education represents a strong predictor of lifestyle-related risk factors, as education may alleviate the social gradient in health outcomes. Education has been associated with major risk factors for chronic diseases such as tobacco use and alcohol consumption in adults. Then, if education is a strong indicator of socioeconomic status, it may be expected that the social gradient of smoking and drinking behaviors always benefit the more educated. But it's not always the case. Great variability exists across gender, age groups, and living settings on these behaviors. In the Dominican Republic, smoking rates are higher among men than women and among low-educated individuals than high-educated ones. And this is also the case for drinking rates in this population. In the Dominican Republic, we have a special population called bateyes, who are communities entitled by sugarcane plantation workers and their families. And these people live in poverty and isolation, rural locations, and most of the time have low or no education. So they have higher rates of smoking and drinking than the general population. And that's because they represent the bottom ladder of the social gradient. Previous reports, the Dominican Republic may support the social gradient of health from three different perspectives: education, gender, and residential location. As there are higher rates of tobacco and alcohol use among low-educated individuals, men, and bateyes residents. However, no further analysis assessed the social gradient of smoking and drinking from a more comprehensive perspective that includes simultaneously education, gender, and residential location as determinants of health behaviors. Evidence supports that the impact of education on tobacco and alcohol varies by age and gender. Therefore, using such analysis becomes crucial to better understand the unique profile of smoking and drinking behaviors in the Dominican Republic. This will be useful information for chronic disease prevention efforts. Further, rates of concurrent use of tobacco and alcohol in the Dominican Republic have not been published. Our study aimed to assess the relationships between educational attainment and tobacco use, alcohol consumption, and concurrent tobacco and alcohol use among adults in the Dominican Republic. Also, we aimed to assess the impact of gender, age, and residential location on these associations. We analyzed population-based data drawn from the 2007 Demographic and Health Survey collected in the Dominican Republic. This was a cross-sectional study. All women age 15 to 49 and men age 15 to 59 who agreed to participate were eligible for this study. Demographics used in the data analysis included self-reported age, gender, male and female, and residential location, general population, and bateyes. Educational attainment was measured using ordered categories. No education, which was the reference group, incomplete primary, complete primary, incomplete secondary, complete secondary, and higher education. Tobacco use was measured as a dichotomous variable yes-no, depending on the participant's answer to the question, do you smoke? Alcohol consumption was measured as a dichotomous variable as well, yes-no, and participants were classified as using alcohol if they answered yes to the questions, have you drunk alcohol? We combined the tobacco use and alcohol consumption variables to measure the concurrent use of tobacco and alcohol as a dichotomous variable as well. Participants were classified as using tobacco and alcohol currently if they answered yes for both using tobacco and drinking alcohol. Those who reported either using tobacco or alcohol were used as the comparison group for this category. Data analysis was conducted using survey statistics in Stata SE version 12. Descriptive statistics and bivariate analysis were calculated. We also completed a multivariate analysis, and for this we used logistic regression models as our dependent variables were dichotomous variables to estimate the odds of education and tobacco use, alcohol consumption, and concurrent use. All regression analysis included demographic variables as control variables, age, gender, and residential location. Among both the general population and the bateyes, the most common educational level was incomplete primary for both men and women. In general, women had a better educational attainment than males, and bateyes residents had a lower educational levels than the general population. This graph indicates that, first, tobacco use among the bateyes residents was higher than among the general population and higher for men than for women in both groups. Also, the alcohol consumption rates were greater among the general population than among the bateyes residents, and males have higher alcohol consumption than females. Concurrent use of tobacco and alcohol was reported in 30.5% of all cases in our sample. And as we can appreciate in this bar graph, the percentage of concurrent use of tobacco and alcohol was greater among men than women and among the bateyes residents than in the general population. This table displays the logistic regression models to predict the odds of our outcome variables. As we can see, having high educational levels decreased the likelihood of smoking when comparing to those with no education. Individuals with incomplete primary education are about 2 times more likely to use alcohol than those with no education, whereas the odds ratios was 3 times higher among those with more than secondary education. That is our higher education category. Although there is not a clear trend on concurrent use, having incomplete primary education increases its likelihood of concurrent use in comparison with the reference group, while higher education decreases such likelihood of using both tobacco and alcohol. Women were less likely to smoke and to consume alcohol than men, and residents in the bateyes were more likely to smoke but not to drink alcohol than in the general population. In conclusion, Our findings support that there is a social gradient in tobacco use in the Dominican Republic. This is, higher educational attainment reduces the likelihood of smoking. There are educational differences on the alcohol use in the Dominican Republic. However, higher educational attainment increases the likelihood of using alcohol. This is the opposite of the traditional social gradient theory. Higher educational attainment is negatively associated with the use of both tobacco and alcohol. These findings should be considered under several limitations though. First, we use self-reported data, which always includes the possibility of recall bias. However, self-reported tobacco use has been consistent with biological samples of nicotine in lung cancer screening, and is also a valid measure of smoking. In addition, self-reported alcohol consumption has been used as a reliable valid measure. Second, the use of categorical variables in the regression analysis might underestimate the inherent variability of the data, and thus obscure some of the small difference across variables. Still, categories are beneficial for addressing theoretically grounded research questions that emphasize individual level content of residential location, which is the case in this current study. Our study findings suggest that future studies in the Dominican Republic related to alcohol consumption and tobacco use under the social gradient perspective should explore these associations, including frequency of tobacco and type of tobacco products, frequency of and types of alcoholic drinks, and also frequency of alcohol use among older women needs to be explored. So far, we conclude that gender-specific, social class-targeted interventions are needed to prevent tobacco and alcohol use in the Dominican Republic. Thank you.